I'm very excited to introduce you to one of our faculty, Dr. Hannah Thompson, who's with the Community Health Sciences Division. Hannah is an epidemiologist that received her MPH in Public Health Nutrition at UC Berkeley, go PHN, and her PhD in Epi and Translational Science at UCSF. Her research focuses on school and community-based methods to increase physical activity levels with the goals of improving youth health and decreasing health disparities. And she's here to talk to you today about evaluating community-based intervention. So please join me in welcoming Hannah.
Hi, everyone. It is so nice to be here. As Michelle said, I am a graduate of the MPH program here at Berkeley. I did public health nutrition. I graduated in 2000, which makes me old. I don't think I need to say that. I don't think I need to say the year, but I'm also just really honored to be here because I actually literally sat where you guys are now. So it's really exciting to have come full circle. And Berkeley is actually where I realized that I wanted to do research. When I did my undergrad, I intentionally went to an undergrad university that had no requirements. Because I got a C+ in chemistry in high school, I decided I was horrible at science. And so I didn't take a single science or math class my entire undergraduate career. I majored in Portuguese and Brazilian studies, which was amazing, not so practical for where I am today. But if you're also sitting here being like, science scares me, or math scares me, or you're not totally sure what you want to do with your MPH, that is totally okay, because I had no clue what I wanted to do with my MPH when I was at your stage. So I applaud you for being here. Congratulations on getting into the program. And so what I'm going to do is talk to you today about one research methodology and then a specific application of that methodology that I do a lot. That's called participatory action research. It's a methodology we use to evaluate programs. And then I'll talk about how we used it to evaluate the impact of an arts-based public health literacy program that was delivered online to high school students during the COVID-19 pandemic. So before I start, we're going to be talking about health education in high school. How many of you went to high school or some form of high school, right? Most of you. How many of you had health education when you were in high school? Okay, good majority of you. How many of you enjoyed it when you were in high school? Okay, so far fewer of you. Okay, so this is really looking at a very different, non-traditional take on health education. Okay, first, so to start out, what I'm really talking about, a lot of the work that I do is what we call participatory action research. It's a research strategy that recognizes the need for people, for communities, for programs that are being studied to actually participate in all phases of that research, right? So instead of a researcher, me and my proverbial ivory tower coming in saying, well, these are the research questions and these are how I'm going to answer them. And then once I have my results, this is how I'm going to share it back to you, if at all, right? This totally takes that model and flips it and involves those you are caring about, right? As a researcher, those you are hoping to evaluate and understand, and involves them in all processes. And it really, truly, at its base, seeks to understand and improve the world by changing it, by making things better. And at the heart of it, it's collective, self-reflective inquiry that we participate in so we can understand and improve upon the practices and situations that we find themselves in. So it's really a real-world strategy that's not just, the goal isn't just to publish a paper in an academic journal. The goal is to really end up with some change. In this case, whether it's for more funding for programs like this, it's to understand, well, how do these programs really work? How do youth respond? How does the program itself work within the confines of the school district to deliver this program? And then how do we potentially scale this, make something like this approach, if successful, available to more students and to more schools? All right, so this work was formed under an academic community partnership. All of the work that I do involves these sorts of partnerships. So again, it's not just me in my office doing data analysis. The work that I do really involves collaboration. So in this case, we worked with a youth-based arts organization called Youth Speaks. They're a nonprofit based in San Francisco, and also with the San Francisco Unified School District, the Center for Vulnerable Populations at San Francisco General Hospital and Trauma Center, which is part of UC San Francisco, and then also here at UC Berkeley. And I also think it's really important to acknowledge my partners in this work. Nobody does this work by themselves. So Gabriel Cortez, who is at Youth Speaks, Dean Schillinger, who's a medical doctor. He's an internal medicine doctor, focuses a lot on type 2 diabetes. He's based at UCSF. Saida Hafiz, who was the director of the wellness programs at San Francisco Unified. Jackie Mendelson, who was an MPH student, she did her summer practicum with me and did all of the qualitative evaluations and a lot of the interviews that we used in this study. And then Maya Zamek, who was my research assistant during this project. Okay, so for just a little bit of background, as we all know, the COVID-19 pandemic highlighted and exacerbated existing health inequities, especially among low-income youth. Further, the sociopolitical climate of 2020, which was coupled with clearly disparate COVID-19 outcomes, amplified conversations on how to address disparities in health outcomes, and also brought to attention the ways in which the environment, occupation, socioeconomic status, racism, and educational opportunities all impact our health and well-being. None of these things exist in a silo. And this constellation of events provides a critical opportunity to really reframe how we talk and engage with youth around health and disease risk more generally. Right? So instead of having this model, this is, I'm standing in front of you as a health education teacher, this is what you should and shouldn't do, you shouldn't have sex, you shouldn't eat this, you should exercise, right? It really reframes the environment in which we are actually living. Okay, so the Bigger Picture campaign is a public health literacy campaign that was originally conceived to expand awareness around type 2 diabetes and type 2 diabetes prevention. So again, from a socio-ecological perspective, instead of saying you have type 2 diabetes because you make poor decisions, right? Because you drank that soda, because you didn't sign up for a gym membership, right? It really, the whole purpose of this public health campaign was to reframe type 2 diabetes as a societal problem, as an environmental problem, as a structural problem, right? It's not like you chose to drink that soda. It's more you live in a neighborhood where only soda is available and the water's not safe to drink and soda is less expensive than the bottled water, right? So it's really trying to think about how do we actually change the systems environments as youth? How do you go up against those systems as opposed to being passive participants? So when the Bigger Picture campaign was originally conceived in partnership between Youth Speaks and UCSF, the whole goal was to really expand knowledge around type 2 diabetes and to increase activism around type 2 diabetes. And this program has been in San Francisco schools since about 2013. And so with Youth Speaks, what Youth Speaks does is they engage youth in culturally relevant arts-based expression programming that teachers provide to youth in like a traditional classroom setting, sometimes in an after-school setting. And it really allows youth to reflect on these social determinants of health. So like the structural factors, the social factors, the environmental factors that influence our exposure to disease, exposure to certain behaviors, and also our disease risk. So we've done a lot of evaluations of this type of program in sort of a non-experimental design. Does anybody know what I mean when I'm saying using non-experimental or observational designs? Anybody want to tell me? Anyone feeling brave? Okay, so when I say experimental, right, non-experimental is when the school district and Youth Speaks are just going to do their thing and we're going to go along and evaluate it the best that we can. Typically, when we're doing observational studies like this, we cannot draw causal inference. We can't say, oh, by adding Youth Speaks or by adding the Bigger Picture to schools, this led to this. We can say this was associated with this, but we don't actually know if it caused it or not. When you use an experimental design, when you randomly assign a certain groups of schools to receive the intervention, and then there's another set of schools that don't receive it, what you've done is randomized it. You kind of assume that all the other factors between those schools are going to be really similar. And so if we see changes, it can be attributed to the program itself. So what we wanted to do, what we did in a first iteration, was we did an experimental design to look at the impact of the Bigger Picture programming in 6 schools in San Francisco. And so then we were ready in spring of 2020 to collect our follow-up data, and guess what happened? Spring of 2020. Pandemic, right? Schools shut down. We weren't able to really finish the study as conceived, right? So up until then, Youth Speaks had been really envisioned as kind of really focusing on type 2 diabetes prevention. But schools closed. And all of a sudden, we couldn't really look at the outcomes we wanted to do. When you do this sort of work, when you work with communities, when you work with schools, it is really different than working in a lab, right? You have very little control over a lot of the things that are happening, right? People are going to be people, kids are going to be kids, schools are going to be schools, policies are going to get passed, funding is going to get taken in and taken out, and pandemics are going to happen, right? So we sort of had to pivot. USpeak said, hey, we want to keep delivering the bigger picture, but we actually don't think that type 2 diabetes is really what we should be focusing on right now. It's still important, but what is actually relevant to youth right now? COVID is relevant to youth. Racism is relevant to youth, health disparities, climate change, mental health. So what Youth Speaks did is they decided to shift the focus of the bigger picture away from type 2 diabetes to more of the salient public health issues that youth were facing. And so then we as researchers in partnership said, okay, this is what you want to do. This is what you think is really important. This is what the school district wants. This is what you want to do. We're going to come in and help you evaluate that to the best that we can. So the success, again, of Youth Speaks had been, when delivered in person in sort of a non-experimental setting, had been evaluated. What had never been evaluated is when you shift the focus away from type 2 diabetes to more salient and relevant health issues for youth, what happens? And then what happens when you try to deliver a health education program online to youth? How many of you took classes or taught or delivered classes in any way during the pandemic? All right, how many of you had your camera on the entire time, every time you did any sort of class or lecture? Okay, some of you guys are not the right audience. You guys are all good high achievers, right? How do you imagine high school students were during the pandemic? Do you think they're all sitting there with their hair done and their cameras on and they're smiling and they're looking good, right? It was really hard to engage youth in online schooling, okay? So the big question is, right? So if they're really barely engaged in actual school, are they even going to want to be engaged in health education, which is already a subject that we know is relatively marginalized. It's not something a lot of kids want to do and want to focus. So this was really the point of this. And then we used an experimental design. Okay, so we had 3 schools that were assigned this newly conceived bigger picture program that was focused on COVID-19 and all of these different sort of health outcomes. And then we had the traditional Youth Speaks program. So again, a Youth Speaks poet mentor would come into the school, they'd come into the classroom, the virtual classroom, they would take over the classroom, and they had 8 different lessons over the course of 8 different weeks where they delivered a curriculum to youth. And they used poetry, spoken word as the vehicle for this. So they'd start out with some discussions, they would do writing prompts, the students could break into different groups, they could practice writing, and then they'd come back and they would share their poetry if they felt like doing this. In the bigger picture schools, they really focused on the social determinants of health, on COVID-19, on racial injustice, on police brutality, mental health, climate change. And then in the traditional schools, regular Youth Speaks, the youth could focus on whatever they wanted to focus on. So it could be health related because clearly everyone was living through the same pandemic, or it could be related to anything else they wanted to do. And this all happened in the spring of 2021. So schools, at least San Francisco Unified, was still entirely online during this point. And so to evaluate this program, we used theoretical framework. So a lot of times when you do these sorts of evaluations, right, you need to start from somewhere. You can't just say, well, I think it's going to change this, this, and this, and so this is what I'm going to measure, right? You need to really think about how is the program conceived and designed, and what realistically is it going to move. So we used the very well-established socio-ecological model of health, which focuses on the societal, cultural, communal factors that produce policy, environmental, structural conditions that are necessary for health promotion. And this was a project that was funded by the Robert Wood Johnson Foundation. They have a nascent culture of health framework because they were funding us. That was then what we also needed to use, because sometimes that's what you got to do when you're getting funding, right? And so we used this framework as well, which really focused on health-related mindsets and expectations, sense of belonging, and civic engagement. The civic engagement piece was really exciting because this is something, right, instead of in a very traditional health education model where you're saying, you know, make these decisions, do or don't do this. The civic engagement piece is really saying, okay, you are not just a participant, right, you're not a passive participant in your health, right? You're an active member of your school, an active member of your community, of society. You have a voice, use it. So really encouraging youth to go out and engage around these sorts of issues. And then we also really focused on the online learning aspect of this. Okay, so for our evaluation methods, we did a pre-post program online survey for students. So at the very first session, they took a survey at the beginning of the class. At the end of their very last session with Youth Speaks, they also took an online survey with their class. And then we also did interviews with participating students. With Youth Speaks Poet Mentors, they are the ones who delivered the program. With the partner teachers, they were the ones whose classroom was taken over so that they could do the program. And then with the wellness staff in San Francisco Unified. So this is what we call a mixed method study. So we collected some quantitative data through these surveys, these pre and post surveys, and then we also collected qualitative data through these interviews. I personally really love doing mixed method studies, especially in studies of this size, because I think, one, they allow you to look quantitatively, right? You can actually measure numerically. You can look at difference in change in different kinds of outcomes. But just so I ask, for example, did you like the program? Yes or no, right? I can say what percentage of the students who participated liked the program, but I have no idea what they actually liked or they didn't like about it. So that qualitative data allows you to go more in depth to understand the processes, the underlying mechanisms for why you saw what you did or didn't see, or if something didn't work, so you can actually better understand why it didn't work. Okay, and so what we did is we assessed mindsets and expectations related to the social determinants of health and health equity, understandings of the causes of type 2 diabetes, COVID, health disparities, past and future civic engagement, as well as online program delivery. Okay, so for our sample survey, we had 140 students who participated across these 6 different schools with both pre and post surveys. You can see the racial ethnic breakdown of these students, a very diverse group of students, very reflective of San Francisco Unified School District, or at least of the schools that we focused that Youth Speaks traditionally partners with. Also a good mix of grades. You can see we had slightly more younger students as opposed to older students. Anybody who's worked in high school or remembers high school, it's a lot harder to engage seniors than it is to engage freshmen. And then also a good mix of genders. And not typically, a lot of times when you have elective health education classes, you tend towards seeing more females. We had a lot of males who participated in this as well, which was something that was exciting. Okay, I will breeze through this because this probably makes no sense to most of you right now, but just put this up there to say in a year or two, you are actually going to understand what this means, and that might feel really scary right now, but it's actually really exciting. If those of you that want to go out and do this sort of work, you don't have to be an epidemiologist to really figure out and understand how to look at findings from your surveys, but we took a pretty sophisticated statistical approach to look at difference in change between our intervention students and our control students. So the students that got this new Youth Speaks program, the new Bigger Picture program versus traditional. So we looked at where everybody was at the beginning of the program, then where they were at the end of the program, and then the difference in that change between those two groups. Okay, so for our student survey, we found that students who are in the Bigger Picture program reported greater difference in change relative to those in the traditional program in response to things like, I'm comfortable sharing my story and speaking my mind. My country should do whatever is necessary to make sure everyone has an equal opportunity to be healthy. I'm comfortable standing up for what I think is right, and I have ideas for what I can do to improve my school or community. So as you can see, these are really different outcomes than we think of when we're traditionally evaluating health education programs, right? We're not saying, oh, I intend to make better food choices, I intend to watch my weight, I intend to not have sex, right? These sorts of things where, right, what we're actually looking at is these broader mindsets and expectations related to health, and also not just individual health, but collective health and more broadly focused on health equity. Okay, we also found greater difference in change relative among Bigger Picture students relative traditional students in a whole slew of civic engagement opportunities. So I'm not going to read these all for you here. You can kind of see them up there, but the point is really to say that youth really got this, and this was really exciting, right? So instead of, again, sitting in your own little silo in your own head thinking that you're the only one that can do or not do anything related to your own personal health, like, again, understanding you're part of this bigger picture. All right, so then we went on and we did interviews with our students. So we did 41 with students as well as adult participants. We did 41 interviews, 23 in intervention schools, 13 in comparison schools, and we had 21 participating youth. So 13 intervention and 8 comparison. Does anybody remember how many youth we had that took the student survey? 140, right? So how many youth do we have here in these interviews? 21. Okay, so why do you think we had so fewer students who participated in interviews than participated in the surveys? Anyone have a guess? Just shout it out. Okay, yes, so one, it's like, right, so they had to opt in, right? When they were sitting there, the survey was totally anonymous, right? They had to opt in. But this was one of the biggest challenges of doing this sort of evaluation online. The only way that we as researchers had to access these students was through their SFUSD email. How many of these students do you think check their school email? No, right? So with qualitative work especially like this, as researchers, we learned a lot about how do you recruit students to participate, right? Youth Speaks was on board. They would reach out to them too, but they also had a much harder time getting in touch with students, right? You're not like we could show up to a classroom and say, hey, we're here from UC Berkeley. We want to talk to you. We offered them incentives for their time. We paid them to do the interviews. It was over the phone, all of these sorts of things. But we know with qualitative work, it is not representative necessarily in the same way that quantitative or an anonymous survey is. And this was something that we learned as evaluators that was really challenging during the pandemic and during when you can only talk to youth through their school email addresses. But we still do believe they had some valuable things to say, but these qualitative findings aren't necessarily generalizable. When we do qualitative research, instead of doing a sample size calculation, which we normally do, right, you want to determine how much statistical power you are going to have to detect an effect size that's of interest to you. With qualitative work, what you usually do is you talk to people until you reach what we call saturation, right? So if I talked to just this table here about your experience today with this program, you might tell me 4 different things. And then if I added you guys and you guys in, I might start hearing all the exact same things. And so I say, hey, I don't need to talk to the rest of the classroom because I've already heard everything that I think that I'm going to hear. We did not reach saturation with this study, and that's an important thing to note, at least with the youth. We also talked to all 4 of the poet mentors, the wellness coordinators, partner teachers, and the district wellness coordinator. And here's what we found from those interviews. So we found that the bigger picture project's expanded focus to include these salient health and social issues beyond type 2 diabetes appeared to be a strong pedagogical approach for engaging youth in a health education setting. The youth really liked this program. They liked both traditional Youth Speaks and the bigger picture. They all really enjoyed it. But by the end of the program, the bigger picture youth specifically were better able to describe the structural and systemic causes of health disparities compared to those comparison youth. So really having that specific focus on health and health disparities helped move the needle for a lot of those health behaviors, health outcomes, civic engagement issues that we were interested in. And then many youth from both groups shared that they looked forward to Youth Speaks even when they weren't excited for their other classes virtually. This felt like a really big win. Getting students, high school students, to engage online during the pandemic was really challenging. They liked this type of engagement. They liked being able to talk about the things they wanted to talk about, to feel free to express themselves in this sort of way. Despite that, online programming is really challenging. So the majority of adults and youth preferred in-person program delivery in the future, which made a lot of sense. I think we learned a lot of really important lessons should we have another shelter-in-place situation. I also think that this approach could also be really beneficial in districts where schools are much more spread out, in rural areas. During the pandemic, Youth Speaks also started sort of like an international program, so students from basically anywhere in the world who wanted to kind of log on and start participating and sharing could do so. So I think there are a lot of benefits, maybe not for all, maybe this isn't the way to do it for everybody though. Okay, and then I wanted to give you guys just a quick sample of some of the poetry that came out of this program. I had originally had a video in here that Youth Speaks has a bunch of videos. They turn the students' poetry into these beautiful, beautiful videos. If you go to Youth Speaks website, you can find them on there. They're a little bit long, so I didn't want to take up too much time here, but please do go check that out because I think that is incredibly powerful and speaks for itself. But these are 2 excerpts from poems by Daniela Hernandez.
Since the air thick, this piece is called Be Careful Breathing. It's been 6 months since the air thickened with the hellish feeling, as if walking among humans wasn't already bad enough. The orange-red skies adds to the scenery. Every deep breath feels dangerous, exposing my health to the roaming diseases, to the smoke that's going to land me in those anti-smoking commercials with a hole in my throat that I would always see on TV. We've had to learn to take precautions, stay 6 feet apart. always have your safety net of a mask with you too.
And I should
This
say,
piece is called Be Careful Breathing.
I should say too, this also took place during wildfire season too. So that's, and those of you who weren't in California during that time. And then here's one more.
It's called McLovin It. Your commercials say McLovin It, and we are. But in reality, we're wasting money back to back to back to your food, raising prices slowly while still keeping it in lower class. What you're really selling is unhealthy, kept animals that were probably treated cruelly, calories and calories of unhealthy processed foods. You first give my people heartburn to heart attacks, fill them with great amounts of calories, getting them addicted to your food. You give our body problems, and let's not forget about our wallets. You're raising prices, and when the ambulance takes one of us to the hospital, we end up in debt. You sell food that people can keep up for 20 years. It still looks the same. What is in your food, dog?
Okay, so in conclusion, we found that Youth Speak, so the programming across all 6 schools was well received by youth and adults, particularly during a time when our country was facing so many health and equity related issues. The bigger picture participation, so among those 3 schools that had the bigger picture project, they specifically resulted in a quantifiable reported increase in students' mindsets around the social determinants of health and health equity, as well as future plans for civic engagement. So these findings suggest that a well-designed and skillfully led arts-based participatory programming that engages youth around public health content can advance a culture of health in the public high school classroom setting among students that are exposed to this form of engaged pedagogy. So online youth health programming, we know, is not without its challenges. It could still potentially be a worthwhile approach when there's limited resources or during times when in-person gathering isn't possible. But I think from doing this work, we learned a tremendous amount about sort of what works and what doesn't work in terms of health education, and some really good lessons to take forward. We are now working still with Youth Speaks. We're in continued partnership with them. As they continue to be in schools, they're also trying to move online a little bit more. So they have all these social media accounts. We're now trying to do some evaluations of social media, like youth's interaction with social media. So like reposts, likes, re-TikToks. I'm not TikTok, so I don't really know any of the right language, but kind of how youth are engaging around that, how they're sharing it, and then also still the potential scalability of these sorts of programs, especially in an online context. That's the part about this that's really exciting, is that you don't have a Youth Speaks in every single city, so it'd be really hard to put these sorts of poet mentors into schools and districts across the country. But if you can sort of try to scale out this sort of online programming, you might have the potential to reach more youth in that way. And then I don't know if there's time for questions, or if anybody has any questions or want to talk more about this. At Berkeley, there's a lot of opportunity to kind of learn about these sorts of programs, and both designing these sorts of programs, but also evaluating them, and then doing policy work or other related work to kind of help support and fund and get these programs implemented. That's, again, the kind of stuff that I'm particularly interested in. A lot of the other work that I do is still in partnership with schools, but a lot of it's focused around physical activity and nutrition in schools, now making more of a move towards mental health in schools. I think a lot of schools, for a while, we were really focused on what we called HEAL, healthy eating and active living, and that was kind of the buzzword, and that's where we were getting funded. And now I think we're moving, schools are much more interested in mental health and ACEs, adverse childhood experiences, and how those impact students and health, but it's all connected. We know that nutrition is connected to physical activity, is connected to mental health, is connected to academic outcomes, is connected to health outcomes, is connected to all of these things that we really care about. But this sort of engaged model, this sort of participatory action research model is something that you could apply to lots of different outcomes that you're interested in lots of different settings, in childcare settings, in health department settings, in church settings. So that's kind of why I wanted to describe this to you all today.
We have time to take a couple questions if anyone has any. Okay, I saw a hand there, and then we'll come to you.
In the context of doing participatory action research focusing on youth, I'm curious, is Youth Speaks a youth-led organization, or how did this program engage young people in co-creation?
That's a great question. So yes, they have youth. A lot of the poet mentors who are paid by Youth Speaks full time are adults because they have to be, but they have student poet mentors that are engaged in the curriculum, that help design the curriculum. They have these poetry slams every year that are entirely student led and student run, and based on student experiences, kind of what they want to do and reflect on. And a lot of this curriculum specifically was developed in collaboration with students. So in a lot of talk around what are you guys interested in, it wasn't, again, me telling Youth Speaks to tell youth. It was really the youth telling Youth Speaks, and then they told us what they did, so then we went and evaluated it.
This was really interesting. I'm wondering so it sounds like Youth Speaks drives the relationship with the schools. Is it hard working with schools and getting in there and saying, hey, we want to take up your class time and curriculum? And is that a pre-existing relationship that you all have formed, like working with the community? And yeah, what was that like?
That's a great question. Working with schools as a researcher is incredibly challenging, right? Especially post-COVID. The last thing schools want right now is more people coming in and being like, I want to survey your students, or I want to talk to your students. And I think that historically, I think researchers have not done a very good job. They'll kind of come in and say, here's my program, I'm going to evaluate it. They evaluate it and then leave. The money leaves, the program leaves. They haven't done a good job of sharing findings back with the community, where the schools haven't done a good job of asking questions that the school wants. So as part of our survey process, we had our questions that we wanted to ask from sort of a more academic perspective that we developed with Youth Speaks. We also had a bunch of questions on the survey that Youth Speaks just wanted to know for their own program and program improvement that we put on there and that we evaluated for them and gave back. With programs like this right now, it totally depends on the school and the setting and the program, right? And so I think, and what schools' priorities are. It is a really short school day, and there are more requirements in a school day than most schools have time to actually fulfill. And it's also all about resources. And so it depends on the school and the district and their requirements. Youth Speaks has had a really great relationship with San Francisco over many years, but it took them years with San Francisco Unified, but it took them years to develop that. And then in turn, it took us years to sort of develop that trust, developing that trust between the researcher and your community partner. It takes forever. For example, I do a lot of work with the New York City Department of Education, which is the largest school district in the country. They did a program that I'm evaluating right now that ran from 2015-16 to 2018-19. It added PE teachers into all of their schools and related to state policy around PE. We are just evaluating that now because it took me about 3 years to get in and to be like, hey, they can trust me that we can do this, and then to write the grant, and then to get the funding, and then COVID, and then to get the data. So all of this can often take a really long time. So it's frustrating. And when you're in an academic position and people care about publishing and they care about all of these sorts of things, it's not always the sexiest thing, if you will, but I think it's incredibly worthwhile work. And for me, it feels so much more important to be doing work that then schools are actually going to be using, that Youth Speaks is using these results to actually advocate for more funding from the district and say, hey, we had luck in these 6 schools, let's expand, or they take it to other health departments to get more funding. So it does take a really long time and it is really challenging, but I actually think it's really impactful. So I think it's worth it. Yeah. Yeah.
Combining other like social determinants of health and other like social justice and like the bigger I see. I just got that.
There you go.
Why it's called the
there
bigger
you go. Learning
like
right
the
here.
bigger picture behind like a lot of other like public health problems. And I was wondering if there was a thought or like how it could be studied to focus in on like one specific big picture item. So, for example, like police brutality, right? So police brutality is an aspect that could be talked about in one of these sessions, but like how would you go about trying to see how to talk to one school traditionally about public health police brutality, but also with the other schools studying it with it's just like one in a circuit of programming with police brutality and racism and environmental injustice, like things like that. Like how would you kind of like subset out one of those kind of like broad picture items?
You mean from an evaluation perspective or
Yeah.
from a delivery perspective?
Possibly both.
Okay. So traditionally, like, right, they were really, when the program first started, it was really solely focused on type 2 diabetes. And so that was kind of like your singular issue focus. And so a lot of the evaluation questions then were really focused on type 2 diabetes related outcomes. So how youth's understanding of the etiology of type 2 diabetes, who's at risk, what can you do to prevent it, what can you do from a societal factor. If, for example, Youth Speaks One wanted to if you wanted to make it just the program just about police brutality, instead of having a specific day where you had discussion around police brutality and a writing prompt related to police brutality, you would just sort of extend that over the entire session of classes. I think it's really hard to talk about a lot of these singular health issues in just a siloed context, because we know, right, police brutality doesn't exist without the economics, the environmental, the education systems that have preceded it, all the history and everything else. And then I think in terms of an evaluation perspective, you would try to do more specific work, asking questions related to those specific outcomes. With an evaluation like this is really hard. So when we try to do these type of evaluations, we want to use validated measures, right? So we want to use questions that have been established to actually tell us what they're going to, right? That they're going to be valid and tell us what we think ask what we think we're asking and get the answers and get answers that are truthful. There aren't a lot of validated questions related to a lot of the work that Youth Speaks is doing, because in traditional health education classes, it's like, how many sodas do you drink a day, right? It like asks these really specific things. And so I think future work that would be really important is we were trying to develop out this culture of health framework and develop questions to better understand whether or not it was working. And so I think future iterations, it's really hard to validate a question around civic engagement, right? You can ask a student, how many emails did you send to friends, but you're not going to go through their entire email and then, actually check to see, well, how many times did you mention police brutality in your emails? You got to kind of take their word for it. But I do think there's some measurement. We could do some advances in measurement, and that would be one way to advance it. And that's also why I think both the quantitative and the qualitative, when you're just starting to kind of learn about a subject or try to better understand it, a qualitative approach is really nice when you don't have validated survey questions where you know all the potential response options that somebody could check. So hopefully that answered the question.
Thank you so much, Hannah. I'm sorry. I wish we had more time for questions, because I know, how many opportunities do you get to ask our faculty about their work. But at lunch, you'll have plenty of time to do that with the faculty in your programs. So for now, please join me in giving Hannah a round of applause. Thank you so much for joining us today.